Psychologists are calling for patients to be able to see them and claim Medicare rebates without a GP referral. They say the requirement makes it harder for people to access help, as the sector is already dealing with a shortage of mental health professionals. Sahra O'Doherty is a psychologist and board director of the Australian Association of Psychologists and joins me now. Sahra O'Doherty, thank you so much for your time. How much of an obstacle to care are the GP referrals and mental health plans?
At the moment, Karina, there are quite a lot of barriers that a person can face when they're trying to obtain a referral to go and see a psychologist. At the moment, a person has to go and see their GP first of all, which can be quite a lengthy process and quite a difficult consultation, particularly if they aren't familiar or have a good relationship with that GP. Also, at the moment, we're experiencing quite a lot of wait times for GPs, and our concern as well at the Australian Association of Psychologists is for people in rural and regional areas where appointments with GPs might be few and far between. We're asking for the government at the moment to streamline this process and to accept self-referrals for psychologists. We would love to have people across Australia being able to self-refer to a psychologist rather than having to access a GP referral initially at the beginning of their sessions and then throughout the process as well.
So you don't see this like other specialist health appointments where you need a GP referral to be able to go and see that specialist?
We actually would love to continue having really close working relationships with all of the GPs that all of our patients currently see. It's just in times of crisis. And we know that at the moment, Australia is experiencing a mental health crisis. We want that process of someone in that crisis experiencing that distress in the moment to be able to come in and see a psychologist of their choosing, which would absolutely make those wait times a lot smaller.
And it's not just the GP referral element that you want removed. You want the number of Medicare subsidised sessions to increase. They were already doubled to 20 in the pandemic, but you want that to go further?
That's correct. So at the moment, the additional 10 sessions which were allowable with the COVID-19 extension to better access expires in December. So after December, there's a chance that it might revert back to the original 10 mental health care plan sessions per calendar year. The AAPi supports the Productivity Commission into Mental Health's findings, or recommendations rather, that those sessions to see a psychologist be up to 40 per calendar year, particularly for those experiencing more complex mental health issues.
So how would some of the things that you've suggested address the huge shortage of psychologists in Australia? Because that's another pinch point in the sector, isn't it?
Absolutely. The referral process isn't necessarily going to be addressing the shortfall of psychologists. However, what the AAPi is also calling for is to have Medicare rebates extended to include the 5,000 or so provisional psychologists who are at the end point of their training and would be able to provide excellent quality services to the Australian public. That would dramatically decrease that wait time as well, having so many more psychologists providing services.
There's also a funding holdup because of states and federal governments failing to agree on a national mental health plan. How urgently is that money needed in the system?
It is absolutely needed yesterday. It was needed 2 years ago. At the moment, we're really seeing the brunt of the funding shortfall at the moment. We do need to have more people in the workforce, in the psychology workforce. And we do need to be making sure that psychology services are affordable as well. So on top of the other recommendations that the AAPi are advocating for, we're also advocating for the Medicare rebate for psychology sessions to be increased to $150 per session. And that would mean that psychology sessions could be either more affordable for patients, but also it would mean that a lot more psychologists would want to bulk bill, would be able to bulk bill patients as well.
Sahra O'Doherty, thank you so much for your time.
Pleasure.